Americares has been one of the main partners that I have relied on because they're willing to supply us with medications that we can give out freely to the patients. And that just makes a huge difference to be able to give good quantities of high quality free medicines. My name is Dr. Rick Sacra, and right now I'm in Kwasemba, Lofa County, Liberia. There are many health challenges here in this part of Lofa County. Number one is probably just access to primary care, basic primary care, access to medications. We see a lot of people with complicated pregnancies, lots of malaria, and then a lot of chronic diseases too, things like diabetes, high blood pressure, heart disease, those kind of things that need ongoing primary care, but there aren't very many resources around. Being able to come with 10,000 doses of a high blood pressure medicine or a heart medicine or a diabetes medicine and good numbers of supplies of antibiotics and things like that just has been very, very helpful. When I figured out that I could get medications from Americares again, and when I figured out that that resource was still available to me as I began coming to Kwasemba, to this brand new little clinic that really had no financial backing, no budget to speak of. That was just a great benefit in really helping us get started with this clinic and get it publicized and get people to be aware that we're here. The first time I ever came to Liberia, I was a medical student in 1987, and we've been here off and on for 25 years. When I first got involved in the work here in Kwasemba, it was through James Korha, who's been a good friend of mine for over 10 years. He grew up here. This is his hometown. So he brought me here and introduced me to the team here at the clinic. My relationship with the local health staff mainly consists in kind of consulting, training, giving advice, giving input. I'm not mainly here to see patients myself. They see the patients, then they come to me with questions. Well, what do you think of this? What do you think of that? My goal is to, improve the services that they can provide on an ongoing basis. I've always felt that it's best to find a place to come, and if one is going to do visits, do them repeatedly. You get to build on your progress each time. I would say that God has just put a strong burden in my heart for Liberia and Liberians. When you're attached to somebody, you don't abandon them when times get tough, right?